Guest speaker Dr. Richard Brown. Today at the Legacy Building, the Ernie Chambers History, Arts, Humanities Museum, we gathered to discuss future steps on making sure that others are getting vaccinated as well as masking up and continuing to follow guidelines for COVID-19 as we head into the new year.
I came out here because it never hurts to learn something new, and by the grace of God, me and my kids have never had COVID, but I am vaccinated. I got the first and the second shot, but I do follow protocol since the beginning by keeping me and my kids safely away from everybody. You know, the only people that really go around would be my family, but even half of the time not that, because my mom and my dad both have had COVID, but my dad's in remission from prostate for the last 6 years, and then I have a 1-year-old at home and other kids, so it's like I try to follow every protocol to make sure like my kids don't get sick or I keep myself, you know, out of the way so that way I don't bring it.
No, I just hope that everybody takes it a little bit more seriously. We're still in a pandemic. It hasn't ceased. And as Dr. Brown had discussed about, the COVID doesn't care about, it has its mission and it has its job. And its job is to kill you. So without the vaccination and the medications to help us, it'll be really sad to know that a lot of people will die.
Why do you believe people should get vaccinated for COVID and also get flu shots?
First of all, flu and COVID are different. You can have one without the other. You could have both or neither. Anytime science and medicine, the ones who practice, say this is something that will protect you against these viruses, I get the vaccinations. As I said, I get a flu shot, the COVID shots, and I got all of the pneumonia shots that I needed. So if you can protect yourself, prevention is better than cure.
I believe in the flu shot. I get it every year because of asthmatic and health conditions. It's worth it. And people should get vaccinated. It's by personal choice because I'm not, there's not enough evidence out there long term for me. So, but I've had COVID twice and I mask up wherever I go. I'm over the road truck driver, so I mask up and sanitize now more than I ever did. I was not a mask person, but now I wear masks everywhere. It's my second skin. So it's important to get masks for the elderly, and it's really bad on the elderly because someone older would get it. It's so horrible. There was 8 colds today. I was in the hospital for a week. So, and I was during that first time, so it was really hard. So yeah, it's something you need to do. You need to get vaccinated for you.
I think that for the safety and the protection of their lives, their loved ones, their friends, we don't want them to leave here. We want to keep them, you know, for as long as we can. And realizing that you need to get your shot, your vaccination, so that you can save others in your family that are older, that have underlying conditions and things of that nature, and your friends. I mean, it would be terrible to say that my grandma passed because I came home with COVID and passed it on to her. How would you feel?
Well, I think it's because you want to protect yourself against other people and your family. So I've gotten vaccinated. My boys that live in the house with me have gotten vaccinated because, you know, I want to remain healthy, and I don't want to, have COVID-19 and spread it to other people.
Well, people should get vaccinated for COVID and get a flu shot because both the flu virus and the COVID-19 virus is still out here in the population. And we're entering into the winter months, into the flu season, and people are coming closer together, and that is when the virus has an opportunity to spread.
It's important to be knowledgeable, to have information on things such as like COVID-19 that you may not necessarily get at home, and then that it's important to stay masked up, sanitize your hands, sanitize your surfaces at home, and to not just protect yourself, but also be in a position of protecting your family.
Why is it important that we still talk about masks, guidelines, vaccines, etc. right now?
To prevent COVID. It's so easy transferable from person to person by breath. I'm a COVID long hauler. And I just stood in a child's presence for a few minutes. The worker didn't acknowledge she had COVID, and it almost killed me. And I've had Omicron COVID also as secondary. So consider I had COVID in my lungs and double pneumonia. So I'm a COVID long hauler now. So that's why it is prevent, because I was only in her presence for 5 minutes and it was just the breath outside. It got me.
Stay away from large crowds, for real. That's all I know, because I went to a funeral. Who would think they'd get it at COVID at the funeral? I did. So I try to stay away from large crowds, and if I do go around large crowds, I wear my mask. And other than that, that's that.
Well, we should keep talking about the mask, because the mask is the one way that we can protect ourselves from breathing in the particles from other people who may be infected. And so now that we're into the holiday season, which I say begins at Halloween, which is a couple of weeks from now, we're going into Halloween, we're going into Thanksgiving, we're going to do Christmas and New Year's. People are going to be coming together and in each other's company, and it is important that they wear a mask in those groups where they aren't sure whether other people are infected or not. And we know that when we're close to each other, the opportunity for small particles to spread amongst people, it can happen. So I encourage everybody to wear that mask whenever they feel like they should, to protect themselves.
Senator Chambers, do you feel that events like this need to happen more often as we approach winter and going into next year?
I think even before we go into winter, anything that gives information about COVID or SARS, the virus as I call it, that's warranted, and there ought to be more of these everywhere in this country.
I haven't seen a lot of like this, but they do need to be more events like this to keep COVID aware on the front line, because right now it's just been brushed back with media and everything else. It's just like, well, there's no more pandemic, now we shut everything down. But there still is a pandemic, just don't acknowledge it because it's not worth the money now. So, but it's still something that's killing all of us, and we need more events like this in our community just to keep raise the awareness and keep it out on the front line. We need a lot more events like this.
People are starting to gather more, and when we can find them gathering, we need to talk to them about what's going on, because a lot of people still don't understand how the virus works or how the flu works, and that when they're together and in the presence of each other, it's a good time to talk to them.
I think in the very beginning, I don't think we all knew or understood the impact that it would have in the long run. I think we all treated it as sort of like the flu, that, okay, we'll get a couple of sniffles, we'll get sick, and then we'll get better. And we didn't realize, or maybe I should say I didn't realize, till today, in hearing the numbers of deaths across the United States, across the state of Nebraska, and then in Douglas County. And then to know that on one given day, that 3,000 people died in one day due to this virus. That lets you know just how dangerous it is and how important it is to mask up and to sanitize and to wash your hands.
I'll just be glad when it's over with, because I had the COVID before, and thank God I got over it. And coming through little meetings like this, you learn more and more and more. Like I said, I just want it to be over with, but it doesn't look like it's not going to be over with in one day or whatever. But I'll be glad when it's over with.
The virus is real. Its only mission is to kill.
Thanks so much for watching. I'm Amber Rodriguez with EWC Communications, and I hope you learned something new.